Welcome to Revenues. As one author once said, our struggle is to identify sources of revenue and the means to obtain the funds. Without funds, all the planning and research studies can't help us out. Laboratories are in the same situation. Revenues are the lifeblood of better health programs. No matter how good the planning or how noble the intentions, without funding, none of the work can get done. In this module, we'll discuss typical revenues available to laboratories and clinics. A major point to remember is that revenues drive budgets, not the other way around. Budgets must balance, and we can only budget those revenues that we reasonably expect to receive in the budget year. Budgeting anything above that amount is useless if you can't pay the bills when they come due. When discussing sources of funding, two terms come up often which are really very different: revenue and reimbursement. It's important that we recognize the difference. Revenue for providing a service includes a margin of profit. If a laboratory runs a test for TB, it may charge the client or the insurance company or some other payer an amount that's equal to the direct and indirect costs of running the test, plus a small amount of profit. Let's say 5%. That small amount of profit can be important to a laboratory or clinic as it allows them to build up some savings that can be used to purchase capital equipment or to cover other expenditures for which funding isn't available. One example might be to cover the cost of testing a client who can't afford to pay for the service. Reimbursement for providing a service will only cover the charge for running the test. It's important to understand the difference between the two when estimating revenues based upon the number of tests the lab will perform in the following year. Some tests will only be reimbursed at cost, and some will be paid and include a margin of profit. These must be estimated separately. If you estimate that all tests will be paid for at a rate that includes a margin of profit, you run the risk of overestimating revenue for the following year and running out of money. There are 6 main categories of revenues that fund the majority of laboratory and clinic services in Tanzania. First are block grant funds. These are budgeted funds distributed by the national government to local districts. There are allocations from the national government's own revenue sources, and they cover such items as personal emoluments and other costs at local labs and clinics. These are allocated to communities using a needs-based formula. Second are basket funds. This refers to funds donated to the country for health-related programs by groups like the World Health Organization, the Global Fund to Fight AIDS, TB, and Malaria, and other healthcare-related foundations. Third, though not as large a funding source as the national government, local government authorities provide a significant amount of funding support for local healthcare. In most cases, this comes from either local taxes or donations made to the local government outside of basket fund support. The fourth major category are health insurance premiums. These are collected as part of registering people for the Community Health Fund. Created to bring universal health care to all of Tanzania, these funds can be used for certain restricted expenditures such as drugs, medical supplies, and equipment. Premiums received are matched by the national government to further augment the resources available. Fifth, though not a major source of revenues for most clinics and labs, fees for services is a growing portion of the revenue pie. They include fees paid by clients, public and private health insurance, and those paid by companies for their employees. Finally, direct grants coming from the national government further help in paying for specific projects and programs started at the district level. But resources available to laboratories and clinics are not always in the form of cash. There are also in-kind revenues which are just as valuable to local health programs. The national government provides training for health professionals and subsidies for drugs and equipment. Programs that allow the national government to buy in bulk and resell to local laboratories and clinics reduce costs for local health units. In some cases, equipment, reagents, and other healthcare-related items are donated directly to local laboratories. Technical support is another valuable resource for local healthcare providers in specialized areas of healthcare. In this way, a small staff's knowledge base is augmented by outside assistance. Finally, local government authorities can provide assistance beyond funding through the provision of land and equipment, advertising campaigns, and healthcare support programs like transportation. There are very few areas that laboratories and clinics can currently increase revenues, but there are two opportunities. The first is fees for services, and the second is registering clients for the Community Health Fund, thereby collecting additional premiums. All other sources of revenue, grants, taxes, donations, are beyond the control of a laboratory or clinic. There are three methods that may help to increase revenues for laboratories and clinics. First, a laboratory could change the rates charged for various testing services, but they must be cautious not to increase the rates too much, which would drive down demand for the service and conflict with their healthcare mission and goals. Second, laboratories could bill all clients for services provided, regardless of what they believe the client's ability to pay is. Third, once a client has been billed, the laboratory can then monitor the amount of time it's taking the client to pay for services, and then institute changes which might help in collecting the revenue. In determining the rate to charge a client for a particular service, we use the surcharge cost plus method. First, we have to determine what it costs us to collect the sample, how much it costs to transport it in an efficient, timely, and temperature-controlled manner, and finally, how much to process the sample. In performing the test, we need to know what supplies we will use, what personnel and how much of their time will be used. And finally, we'll need to allocate a portion of any overhead and indirect costs to the test. These overhead and indirect costs would include things like equipment depreciation, rent, utilities, and administration. As we discuss costs in greater detail in later modules, this will become much clearer. Finally, what is the target profit margin that should be added to each service? Billable services are those which are directly related to the diagnosis and treatment of the client, and which can be billed to that client. But remember that some services may already be paid for through the terms of a grant supplying resources and funding for that service. In the case of grants, determine which services you are legally and ethically able to bill for, and for which clients. In the case of target populations, some may be covered by the grant and others not, such as a test for infants that's not covered by the grant for adults. Other procedures that you can't bill for include standards, quality control, and repeat tests, as well as anything that's experimental and that provides no diagnosis benefit to the patient. This is where the profit margin in our pricing model comes in, covering those costs which cannot be billed to a particular client. A best practice in billing clients is that all clients should be presented with a bill for service regardless of their ability to pay. Preferably, their bill should be given to them before they leave the laboratory or clinic, but after they've finished with their visit and received their diagnosis. It would be unethical to give them a bill for services before receiving their results or diagnosis, as this would be equivalent to holding the results hostage for payment. The first priority is the client and the community's health. Too many problems can occur if you attempt to determine a client's ability to pay and then decide on whether or not to bill them. You may have been provided with incomplete information by the client. The client may mislead you in providing financial information. The client may have access to funds from other sources to pay the bill. The client may be able to pay at least a partial payment towards the bill, the rest which would be forgiven by the laboratory or clinic. It never hurts to attempt to bill for services, even if the payment is not likely. The upside is additional revenue for the lab, which can assist in helping to pay for other clients who lack the resources. A simple report, called an accounts receivable aging report, is used to track the total amounts billed to clients and how much time has passed since the bill was first presented to the client. These can be easily set up in a spreadsheet program. Aging reports typically help to track clients who are 30, 60, and 90 days overdue in paying their bill. But these cutoffs are arbitrary and can be adjusted depending upon management's needs. By monitoring the report, it allows the laboratory to see which clients may be more difficult to collect from, or those who may need a reminder that they still owe for a particular service. If there are bills outstanding after a reminder has been sent, and they have gone beyond a predetermined amount of time, such as a year, the lab may consider them uncollectible and write them off. There's nothing wrong with writing off uncollectible debt, as long as proper collection procedures have been followed. The only caution that should be made is not to assume that all services that have been billed for will be finally paid. Be conservative when budgeting for this revenue, allowing for a percentage of the total to be uncollectible. If the laboratory or clinic has no experience with collecting fees for services, they might want to discuss it with other labs that do, to determine what's a proper amount to consider uncollectible. Is it 20%, 40%, or more? Failure to do this could mean that a lab over-budgets uncollectible revenue and runs out of money. Here's an example of an aging report. On the left side, we see the customers. In the case of a laboratory, these would be clients or patients. The current column indicates how much has been billed today. The days past due columns aggregate total billing to the client that falls within certain past due increments, whether it's 1 to 30 days, 31 to 60 days, or more. In this case, the furthest out this table extends is to over 90 days. These increments, as well as the final over 90 days, can be changed based upon the needs of the organization. You may want the last days past due column to be at 180 days or 6 months. The far right column shows the total amount billed to and outstanding from that client. The totals along the bottom of the table show the total amount of billed services outstanding in each days past due increment. In this case, notice that there is no amount past due over 90 days. One of two things occurred here. Either the organization was very good at following up with clients to receive payments, or they have a policy of writing off any billings that are past due after 90 days. As discussed earlier, a lab cannot assume that all the clients who have been billed will pay. It must therefore determine a collection rate, which is the percent of billable services that it estimates it can collect. Once it has a history of billing clients and collecting revenues for the billable services, it can begin to calculate collection ratios. These ratios will help provide support for a better estimate of a collection rate, as well as how the lab should budget for billable services in the future. This collection history and these collection ratios is also useful in supporting creditworthiness if the lab ever needs to borrow funds. Now there are three collection ratios. First, total amount collected divided by the total amount billed. This can be over any time horizon, such as the previous 12 months, 30, 60, or 90 days. It's useful to compute all of these as collection rates can change over time. As an example, assume that the local economy weakened during the previous 6 months, resulting in increasing unemployment. That information would not be reflected as strongly in the previous 12-month calculations as it would be in the previous 90-day calculations. If you use the previous 12-month calculations to budget a collections rate, you'd run the risk of over-budgeting revenues and possibly running out of money in the next budget year. But caution, if it always takes the lab's clients a longer period of time to pay, don't use too short of a collection time horizon. Too short of a time horizon will result in an abnormally low collection rate, resulting in the under-budgeting of revenues for the following year, and it will force the lab to cut its expenditure budget for the following year when it really didn't need to. The second ratio is accounts receivable divided by the total amount billed. This is simply the reverse of the first ratio, showing how much still needs to be collected as a percent of the total billed. The third ratio is the number of patients who've paid divided by the total number of patients who are billed. This provides the information from a different point of view, letting the lab see whether the inability to pay is a widespread problem or just with a small portion of clients. Finally, a profit ratio is used to determine whether a lab is making or losing money during a year. It's calculated by dividing the total revenues by total expenditures. If the result is less than 1, then the lab is losing money. If it's greater than 1, then it's making some money. A profit ratio can be used to compare one period to another as long as the time horizon is of the same length. For example, a calculation of the most recent 90-day period can be compared to the previous 90-day period. By comparing the results, management can determine whether the lab's financial condition is improving or deteriorating over time. When making revenue estimates for the next year, the revenue side of the budget should always be done before the expenditure budget. Revenues drive expenditures, not the other way around. Now, revenue estimates are based upon many different inputs. The previous year's revenue experience, which includes the collection rate for billable services, planned changes in service levels, any information you have regarding next year's transfers from the central government, local government, or donors, and other demographic and economic factors which may impact next year's revenues, such as changes in unemployment. We'll investigate this in more detail in the forecasting module. The expenditure side of the operational and capital budgets will be restricted by the estimated revenues. These revenues must be estimated conservatively, or the lab may experience cash flow problems, meaning it may run out of money. When a government collects less revenue than it spends, it can do one of three things: tax more, print more money, or borrow more. What can a laboratory do? What do you think?